systemic vessel of the lung sequestration. You can see those kind of images. And we are quite confident that in the next few years, MRI will prove useful as well to study the fetal heart. For the moment, it's quite hampered by the heart movements, but it's getting better and better. And you can see some images of the fetal heart moving. This is what we would call a 3-vessel view. And this is a 4-chamber view here, and we are going up to the 3-chamber view. And you can see that we are now starting to see the fetal heart quite well, even with MRI. So remember that for the thorax, MRI will give you some additional information, especially for fetal lung volume in congenital diaphragmatic hernia, in the management of masses, and for the heart, it's coming quite soon. Let's have a look to other organs. MRI can be used, especially with dynamic sequences, to look for the normal swallowing of the fetus, and you can see that fetus. What's wrong with that fetus? Okay, everybody's sleeping. What do you think? Okay, look at the position of the tongue. Look, the tongue is in the nasal fossa. Look at the retrognatism. This is a fetus affected with a Pierre-Robin sequence, and you can see that it's quite easy to see as long as you know that sequence with MRI, and it can be quite challenging at ultrasound. These are 2 other examples of the use of dynamic sequences in fetus affected with esophageal atresia. You can see very well here on the dynamic sequence the esophageal pooch. This is the pooch side, which is quite difficult to be seen at ultrasound. It's quite obvious on MRI. As well, MRI can be used to see the normal development of the bowel, and it has a specific T1 hypersignal on MRI. And last, MRI can be used as well to look for bladder and kidneys anomalies, and this is a nice case of reflux. You can see the urine coming up from the bladder to the kidney. Another field that we like very much is the use of MRI to look for the normal development of placenta. This is mainly the field of annulodiminisher. You can see here that MRI will provide you an excellent tissue contrast to look for the normal development of the placenta, and more importantly for the normal invasion of the placenta. Abnormalities of the placental invasion is an increasing issue. You've got more and more cases of placenta accreta and percreta, and those cases carry a high risk of maternal morbidity and mortality. So you really need to use whatever you can use to improve your diagnostic capabilities, and MRI clearly can help you in the diagnosis of placenta accreta. For these cases, if the morphological examination is not enough to rule out the placenta accreta, we will then use contrast media in order to look for the normal enhancement of the placenta. And with annulodiminisher, we developed a quantitative tool to assess the normal perfusion of the placenta to help us distinguishing between accreta and non-accreta placenta. Within the lab, we've also developed, mainly in animal models, functional tools, either based on dynamic contrast enhancement, on speed leveling, on both, or on diffusion, to look for the normal function of the placenta. And what is the issue of looking for the normal function of the placenta? It's because placenta will be directly related to fetal growth, and the better the placenta works, the better the fetus growth. And this is really an important issue. We don't have enough mean with ultrasound to assess the normal growth of the fetus and the normal function of the placenta, because we only have Doppler, and Doppler are not a good enough mean to assess the normal function of the placenta, and MRI could really prove useful in the next few years. So for the other organs, what you must remember is that dynamic sequences can help you mainly for the digestive and gastrointestinal tract anomalies, and MRI is also very useful for the assessment of the placenta, either for the normal adhesion or the normal function. As you can see, you can have a complete morphological examination of the fetus with MRI, and this is something we're working on, especially for obese women. You can use MRI to assess the entire normal anatomy of the fetus, and this is a work that has been published by Radiology, where she demonstrated based on 100 cases that MRI can be used as a reproducible mean to assess the normal development of the fetus, and they were able to complete a normal morphological examination as based on the ISRO guidelines in 100 MRI examination. This is mainly because of the very large field of view of MRI. You can assess the anatomy either on sagittal views or on axial views very quickly and very efficiently. And for those of you who are quite used to the normal examination of the fetus, you can see that on almost 1 sequence you can see almost everything in that fetus, including the arms and legs, etc., etc. 3D MRI is also moving quite fast. It's not for the moment as good as ultrasound, but it's quite good, and I think in a few years that will be as good as ultrasound. And these are images from Jean-Philippe Beau and Bernard Benoit that show you what you can see now with 3D ultrasound. These are very nice images of 3D ultrasound. And sometimes it's difficult to see what is reality and what is not. This is an amazing movie. Twins. New technologies, quite amazing. Okay. So you have seen what are the advantages of ultrasound, what are the advantages on MRI, and the last field I would like to discuss with you is the field of fusion imaging. Fusion imaging allows you to have at the same time the ultrasound and the MRI on fused images. This technology is available and has been successfully used mainly in adults in the field of oncology, but it has not been used in the prenatal field, mainly because fetal growth and movements may hamper the extent of the merging of the data from ultrasound and MRI. So we did a study to evaluate the feasibility of fusion imaging in the prenatal field. The fusion imaging system is based on a normal ultrasound machine. So this machine makes US images in the traditional sense, but it can also simultaneously fuse together with the MRI images that you acquired just a few minutes ago. So the first step of fusion imaging is to perform a normal MRI, and then you will perform an ultrasound, but with a special probe, and you will first register your image together with the MRI volume. So you'll have to say to the system, okay, this is the plane where I am. So you will need some landmarks on your plane, and from that plane you will be able to do your live scan, and the machine will at the same time move within the MRI volume to allow you to see both your live ultrasound image and the corresponding MRI image from the volume you acquired a few minutes ago. Is that okay? So how you do the registration, you need to define one plane and one point, and this will define a strict and unique plane, or you can define the plane using 3 different points. And then from that starting plane, you will navigate within the volume with that special probe that is using both an electronic transmitter, an electromagnetic transmitter, and electromagnetic sensors. The electromagnetic transmitter will create a field with field patterns that are arranged such that the system can determine a unique spatial position and orientation of the probe using the two sensors that are attached to the probes. Is that clear? So this is how it works. You first do the MRI. This is not commercial, I'm sorry. You first do the MRI. You get your MRI volume, and then with your electromagnetic transmitter that creates a special magnetic field, and with your probe that allows the system to know where you are in the space, you'll be able to move within the MRI volume at the same time you are doing the ultrasound. So with that technique, you don't have to choose. You remember you had a difficult choice between ultrasound and MRI, and it's a bit like having to choose between a Ferrari and a Maserati or Lamborghini. They are both good. But with that system, with that fusion system, you can use the two at the same time. And this is, for example, a brain examination in the axial view, and you can see at the same time the ultrasound image and the corresponding MRI image. This is the same thing in sagittal views. And you can also add the information, for example, of Doppler on your MRI image. And this is the image of the Willis polygon that is superimposed on an MRI image. These are some other examples. And these are really new images because you can add the information of both ultrasound and MRI. So what is that for? Well, we believe that the main indication is to train and teach people to recognize the main anatomical landmark or to recognize the main organs. You can see, for example, on these images that come from Marie Brasser, how easy it is to perform a brain scan within the 3 planes of the space.